Heba Mohiuddin is going to join us, founder and director of Equitable Access. Heba, thanks for joining us. We appreciate it.
Thanks for having me.
No problem. So first of all, tell us what Equitable Access is.
Yeah, so a little bit backstory. There's actually quite a bit of backstory. My dad from Pakistan, when he was around my age, and he moved here for a lot of different reasons, but one of the reasons was healthcare. Moving from completely alone to from his family, promised 10 years of extra life for children, and so healthcare was a huge aspect of that for him. So whenever there were a number of cases that came up challenging access to, eroding our healthcare system, challenging access to life-saving medication, I was heartbroken. And so one of those medications was PrEP. So our Equitable Access came from that, and we're trying to fight for equal access to life-saving medicine, specifically PrEP, which prevents HIV.
Okay, so now there's so many things that spring out of that, right? So first of all, now we've got crazy right-wingers saying that we should not have healthcare cover the HIV medicine anymore. We thought we were done with this stage of America, but apparently we're not, and they're bringing that fight back. And they say that's because they think the gay lifestyle is immoral. So let's tackle that one first. And by the way, I love your story of your dad wanting to extend literally your life by bringing you here. But little did he know that private health insurance would take over and destroy that. And now we're losing life expectancy in America. But I'm curious if you guys have dealt with that issue of some right wingers now saying no, healthcare coverage should not include medication for HIV.
Yeah, no, that's a great question. Really, what is surprising is that this issue is quite bipartisan. It's something that is what we would say is really common sense legislation. It's kind of one of those things I think people don't even realize is happening. And so it's common sense for a number of reasons. It literally prevents HIV, and we, have for 2 decades, presidents have promised over and over and over again that they would commit to ending the HIV epidemic, and it just hasn't happened. And this bill is it's cheaper, it's cost effective. Obviously, it's a great prevent the contraction of HIV, and it's also equitable. So it's one of those things that weirdly enough is quite bipartisan, and it's just common sense legislation. And we're really hoping that legislators can see that this isn't a partisan issue at all. It's really just ensuring people equal access to life-saving medicine,
So I'm curious. It's just a personal side note for a second. Let me ask you about your dad. So you said part of the point was to extend life and stuff. Whether it's your dad, your family, are you guys just kind of a little bit disappointed in how it turned out? That we've got runaway corporatism here, and corporations run the place, and they do let us die for profit?
I definitely think that it is something that is been an issue with. It seems with this specific issue, it's a matter of people not paying attention, especially people who this would most affect. For example, a huge problem with PrEP medication access is that people who need it aren't able, don't even know that it exists. So a huge part of our campaign is also outreach, making people aware of it. So I'm not sure if it is which problem it is, but we're kind of trying to tackle a lot of them at once.
Yeah. Was it good at some time? Was it a mirage? Have things gotten worse?
I definitely think that from the perspective of my own is that I have noticed how the eroding of the healthcare system specifically, that's what my focus is that by preventing people from accessing medicine that can save their life, it has been an erosion. It's a movement towards it's a movement backwards, especially from something that is bipartisan. Everyone can agree that we need to end the HIV epidemic, and it's upsetting that no one is doing it. And we're really hoping that people will. I definitely think that, especially in the regards of healthcare, these kind of cases that are trying to take that medicine away is eroding our healthcare system, unfortunately.
Okay, so Heba, you guys got this change.org petition, right? We'll put the link down below. Keep HIV preventing medicine free, right? So right now, what is the main issue in the law that is preventing that? If, and what can people do to help?
Yeah, so the main issue are these cases that are all over the United States, and we are trying to codify what already exists. It's the status quo to cover medicine like PrEP that completely prevents the contraction of HIV. So if there are lots of ways for people to get involved. You could sign our petition. That is step number one. And also feel free to reach out to us at our email, which is equi.access@gmail.com. If you want to learn more about how we're trying to ensure HIV preventing medication in the United States.
And you said it a couple of times, hey, this is a bipartisan issue. Why wouldn't we want to keep people healthy, et cetera? Okay, generally I agree, but in my experience, Republicans don't really care about anything like keeping people healthy, helping people with HIV. They used to. George Bush actually talked a lot about HIV and actually did it was one of the few things he did well, and I gave him a lot of credit for it. He gave a lot of funding for HIV prevention and care in Africa, as well as here. And so credit where credit is due. But here, who are the bad guys? Is someone trying to make it sure that the HIV medicine is not free?
Yeah, I mean, there are a lot of people who are using scientifically inaccurate and kind of discriminatory beliefs to try to justify taking that medicine away. And that's kind of the reason that we are so fighting against that, is because I think it's a matter of misinformation. If you look at the numbers, it costs us it's way less. It costs $140 per month to provide PrEP to prevent the contraction of HIV, while it takes $1,800 a month to treat HIV. So it is so much cheaper to provide PrEP. And that is the main, I think people assume that it's more expensive, and it's cheaper, it's more efficient. And so with people who are using this information that is objectively incorrect, come around and are able to see that this is just objectively the best thing to do, but we don't have a lot of control on that.
So Heba, I don't know what your political opinion on this is, but it seems like if we had universal health care, like for example, Medicare for all, you wouldn't have to fight each one of these battles. Oh, please don't let people die from HIV. Please don't let people die from cancer. Please don't do this, don't do that, where we're all kind of begging for our lives nonstop. I know this doesn't happen in other developed nations. They all have universal health care, and none of them have to beg like this. But I'm curious your take. Am I missing anything, or is that the obvious answer here? If we went to universal health care, this wouldn't be an issue in the first place.
I am not sure. I have talked to so many experts who really do understand the Medicare or the healthcare system and the infrastructure better than I do. And so I'm not sure, but I do hope that whatever is best for people in the United States, for all Americans, that is what happens. And I know that the first step in doing that, especially for ending the HIV epidemic, would be providing PrEP medication.
All right. Everybody check out Equitable Access. Heba, thank you so much for joining us. We really appreciate it.
Thank you so much for having me.